And now our next keynote speaker, Steve Downs, co-founder of Building H. Steve, take it away.
All right, thank you very much. Let me just share my screen so you can get my slides. Take just a second and go into present mode. All right, I assume everyone can see me. Thank you so much for having me. I'm really excited to join you because of what this collaboration represents and the potential to build on it. COVID has seemingly been both a sprint and a marathon, and it continues to demand our focus. But as you're doing today, it's important to pull back from it and reflect on what we've seen and what we've learned and take a moment to look forward as well. And in that spirit, I wanted to share a few observations. First, with CA Notify, we saw leadership really step up and transcend their individual interests, sort of working across sectors to focus on the greater good for the state and the nation and beyond. Second, the really high prevalence of underlying chronic conditions in the US created a situation where we got a lot more morbidity and mortality than we otherwise might have. And so this is a key point of sort of what our base state was and something I'll come back to. And related to that, we saw the underlying inequities in our society play a huge role as well in leading to inequitable outcomes, particularly in the mortality rate. We also saw both the value and limitation of using information to guide people's behaviors. It's really remarkable when we think about all the information that was able to be provided and communicated so swiftly during the pandemic. I mean, just detailed, granular, almost real-time data on the spread of the epidemic and into very localized regions. And even though there may have been some missteps here, I think the communication about what was known about the virus and how it worked and how we needed to respond, that was changing rapidly, all that information and evolving. It was really, I think, heroic work to put that out. At the same time, we also saw that for a lot of health decisions, information isn't everything. And we can get the information in the right time and the right way to the right people. But health decisions, as we know, are complex. And information is always a factor, but not necessarily the driving factor. The other thing along those lines is that we saw the value of, there we go, design choices. And I think some of the slides about the different adoption rates with Apple and with iOS and Android are about design tweaks, right? It's about making something easier means that more people are going to use it. And this is not a new lesson, of course, but it's one that bears repeating. And the last observation, which really just came from the last panel, I had to add this slide in at the last second, was that, boy, does scale really matter. I mean, you talk about, first of all, just the outcome of potentially, 25 to 89,000 cases averted is just extraordinary. And that's fantastic, a fantastic outcome. But it comes from extraordinary scale. And it comes from the scale, the reach, the presence of Apple and Google on smartphones. That you can get to that many people really talks to the power of that kind of scale. So how can we build on this? And I think it's valuable to look at what's been created and what's been learned. And I think you start with the actual notification exposure system, the exposure notification system. First, there's a technical infrastructure and perhaps even more importantly, the technical know-how of how to be able to create something like this. But there's also, I think, very importantly, the model of citizen engagement in the process. And so I think those are a couple of things that can be built on. Erica Pan talked about, I think, very much the idea that this could be extended to other infectious diseases. And I think that that's certainly an important opportunity. The other thing maybe to think about is exposures to other kinds of factors that affect everyday health. Maybe things like noise pollution or air quality or fast food, or maybe even fast food advertising, exposure to social contact. And I mean that not in the infectious disease context, but in the social connection builds health context. You can imagine some of this is almost like an expanded version of the weekly screen time reports we get on our phones now. There's also, I think you can build on the model of collaborative leadership across sectors. And I think there's a wonderful opportunity to build on this and apply that kind of collaboration to the challenge of preventing chronic illnesses. And I'm going to focus the rest of my talk on that opportunity. So I want to start by looking at obesity. And if you see the curves here, what you see is a gradual, stubborn, steady rise over many decades. You know, it just keeps getting worse every few years, and it adds up. So, you know, 1960, about 13, 14% of Americans were living with obesity. That number is now 42, a tripling. And then the bottom curve is actually severe obesity, which barely registered in the population in 1960. It's now up between 9 and 10%, with some projections saying it may hit as many as 1 in 4 American adults by the end of the decade. Diabetes has a similar story, right? About 1% prevalence in 1960. It's now thought to be around 10%. I think the number of pre-diabetics is probably around over 30% now. And again, as with obesity, no signs of letting up. So what happened? What changed? Why did the curve start to go up like that? And you know, the first hint is it wasn't our genomes, right? Evolution doesn't quite work that way. It's only really been 2 or 3 generations. So our bodies have not necessarily changed in terms of our genetics. What happened is we changed the way we live. Our food is, we eat more food and it's probably in general not as good for us. We're less active, and I think actually part of it is we've shifted a lot of physical activity away from kind of our everyday routines into actual discrete special workouts, which if you think about it is a bit of a luxury. And so that's changed. We're sleeping a lot less. And there's a lot of concern about increased social isolation and loneliness. And finally, we don't spend very much time outdoors. And I think there's a lot of science recently that's showing the real health benefits that come from being exposed to the outdoors. So to sum it up, we've created a modern society in which it's actually hard to be healthy. And I don't mean impossible. Obviously, people do it. But let's face it, it takes work. It takes vigilance to stay healthy in the US these days. It's as if we're swimming upstream against the currents of modern life, against the abundance of cheap, ultra-processed foods, against a car-centric transportation culture, and against bottomless bowls of Netflix and Instagram and TikTok. You know, I think one of the things that we often do in this situation is that we tell people to do better. You know, we ask them to try harder, or we provide more information or more tools to help people sort of take on the challenge of getting more healthy. But, you know, you saw the graphs, it's not really working. And also this approach, by sort of putting it on the individual, is a terribly inequitable way to go about it. And so I want to emphasize very clearly, you know, the rise in chronic illness is not the fault of individual people. The currents are just too strong. And as important as it is to develop creative ways to help people cope with that, we're not going to solve this crisis with Pelotons and Fitbits and meditation apps. What if instead we could actually reverse the direction of the river so that healthy behaviors actually flowed naturally from everyday life? To do that, I think we're going to have to do some reimagining, some very fundamental reimagining of things like how we eat, and how we sleep, and how we get from one place to the next, how we socialize, and even entertain ourselves. But to do this all with health as an explicit design goal. You know, this is actually kind of an old idea. Public health has been saying, make the healthier choice the easier choice for a long time. But to do that really takes everyone coming together. It takes public policy, it takes physical infrastructure to shift the built environment. And what I think is actually the most important, it's going to take the new products and services that will come from new technologies. You know, we are in the wake of, in the midst of, and always on the cusp of extraordinary advances in technology. What you all did with CA Notify wasn't possible when we first had SARS in 2003. And of course, there's always plenty more to come. Elon Musk recently said that physical labor is soon going to become optional. Mark Zuckerberg wants us all to meet and converse and hang out in the metaverse, whatever that is. And we are marching ever closer to recreating the world of the Jetsons. So we know that new technologies are going to reshape our lives and our behaviors once again. And then the key question is, as it does that, as they do that, are they going to make it easier for people to be healthier? And I would tell you, the answer is not a given. It's not a given that it's going to make it easier to be healthy. In fact, history would sort of suggest that that's not usually the case. So we have to be intentional about this. And I think that's the real opportunity for leadership. Dan Heath, the business school professor, wrote a book called Upstream last year, in which he looked at the question of why it is that we so often focus all of our resources on solving problems at the downstream end, rather than going upstream and trying to solve problems at their sources. And one of the answers, he said, is that so often these problems are complex and they're sprawling, and so that no one leader, no one actor, no one organization really has ownership over them. And so in order to solve that, nobody owns the problem. So in order to solve that, what happens is that leaders have to look beyond their own remits, beyond their own responsibilities, and say, this problem is really important. And I'm going to take a step towards solving it. And when they do that, they bring others along with them. And that's how those problems can get solved at their sources. So I think that's the opportunity here. I think there's a huge opportunity for public health leaders to engage the private sector in a really positive, constructive way, as you've done with CA Notify. To engage them to imagine what could be built that would enable people to live healthier lives, that would make it easier for people to live healthy lives. And for tech leaders, I think there's an opportunity to really take ownership over your power and your influence, the power to affect the way people carry out their lives day to day, and to rise to the challenge of building health back into people's everyday routines. So I think CA Notify has been a tremendous example of that kind of leadership, that collaborative leadership across sectors to come together and to get something really important done. And I'm hoping we can build on that for the future. Thank you very much.